Hi, this is Vaibhav Vaidya with the Fits on the Go blog here at AHA 16 in New Orleans. Today we are joined by Dr. Parkash from Dalhousie University in Canada. Thank you for joining us.
Thank you for having me.
Could you tell us more about the late-breaking clinical trial that you're going to present, SMAC-AF?
Yes, so the study was a randomized clinical trial. It was an open-label, parallel group with a blinded endpoint evaluation looking at the effect of aggressive blood pressure lowering in patients undergoing catheter ablation for atrial fibrillation. So our hypothesis was that patients who have a atrial substrate for atrial fibrillation could undergo modification with aggressive blood pressure lowering, thereby reducing recurrence of atrial fibrillation. So the study was somewhat mechanistic, but a randomized clinical trial looking at atrial fibrillation recurrence.
Got it. And how did you define aggressive blood pressure control, and what medications did you end up using?
So aggressive blood pressure control was defined as a target blood pressure of less than 120 over 80 millimeters of mercury. The blood pressure medications used were not experimental. We started with an angiotensin II-based regimen. So quinapril was the first medication at a dose of 20 to 40 milligrams. The second step, if you did not achieve target blood pressure within 2 weeks of randomization, was hydrochlorothiazide, followed by atenolol if they were not already on a beta blocker or calcium channel blocker, followed by Norvasc and terazosin.
Got it. Wonderful. And what were the results of your study?
The primary outcome was time to recurrent atrial fibrillation 3 months post-catheter ablation, and the results were that there was no difference between aggressive blood pressure lowering and standard blood pressure treatment according to Canadian guidelines. We were somewhat surprised by the result, but this is where we're at.
So it's interesting that the endpoint was at 3 months, because usually don't we blank AFib outcomes at 3 months because early recurrences may not necessarily be predictive of late recurrence. So how did you guys end up choosing that endpoint?
So that is correct. We did blank 3 months post-catheter ablation. So we did not count atrial fibrillation recurrence towards the primary outcome in those patients. We did look at a number of secondary endpoints looking at atrial fibrillation recurrence post-randomization and any atrial fibrillation post-catheter ablation. Again, there was no difference between the two groups. The only trend was there was a less a trend towards recurrent ablation therapy in the aggressive blood pressure control group.
Got it. All right, wonderful. Well, thank you so much for sharing the results of the trial with us.
You're very welcome.
Okay, for more videos like this, please go to youtube.com/fitsonthego.